I'm talking today to Professor Azeem Majeed from Imperial College. Azeem has kept us up to date this last few weeks with the changes in the epidemiology of COVID.
The ONS published over the last few days data on weekly mortality rates. These show that in the week ending April 10th, there were 8,000 more deaths than we would expect at this time of year. So normally around this time of year, we get around 10,000 deaths per week. We now have around 18,000 deaths, which is a very striking increase above normal rates. The bulk of those deaths were due to COVID-19 infection, but there are deaths from other causes as well. So I think one of our concerns is that people are dying from things like heart attacks, strokes, and other infections because of concerns about visiting healthcare facilities such as general practices or hospitals. And we know from data from the NHS that, for example, there's been quite a dramatic reduction in people attending any departments over the last month or so. They're down by about 40% from this time last year. And tragically, we've seen a very large increase in deaths in people in care homes, for example, which will probably increase even further when the latest figures come out next week. And one of the concerns I have is that I think, have got a weakness in our system. So GPs are coping quite well with people they're seeing, hospitals are coping well with people they're seeing, but there's a group of people at home who are isolating with infection, probably COVID-19, who aren't being well monitored. And some of these people, unfortunately, will develop major complications and sometimes even die. So I think we need to think about this group of people who are falling between hospitals and GPs in particular.
You've spoken recently about the ages of those who have died and those who have been serious illness, and how with the age gradient, people over 60 should be perhaps isolating.
Yes. So my view is if you are in your 60s, you should take additional precautions. So avoid large crowds, be very careful about personal hygiene, avoid excessive mixing with other people, in the same way the government advises for people age 70 and above.
This brings very much into focus the policy of bringing retired doctors back into practice. That doesn't really seem to be the right approach.
No, and I agree with you very strongly there, Donald. I think if you're a doctor coming back in your 60s or 70s, you shouldn't really be doing frontline clinical work where you're seeing people who might have COVID-19 infection. You can have a role, which should be perhaps supporting NHS 111 or doing telephone and video appointments with patients or providing other services to the NHS. So there are many ways you can support the NHS as an older doctor or nurse or healthcare professional, which don't involve direct contact with people who might have COVID-19.
This seems to highlight also some social inequalities.
Early data suggests that we might have an excess number of deaths in people from ethnic minorities, for example, and that's something we need to investigate and look at that very carefully. Tragically, of the doctors who've died, nearly all have been from ethnic minorities. We need to understand why that is. Is it because of their age, their health problems, or some other biological factor? And put in place appropriate PPE for all NHS staff, not just doctors, but everyone dealing with patients who may be infected. So I think the PPE is very important because the experience from China and Italy shows that if you increase the grade and quality of your PPE and train people to use it properly, you do cut the risk to healthcare staff quite substantially via that method.
May I ask you about another issue, and that is how these social inequalities affect the population as well?
Lockdown clearly will affect people differently depending on their housing circumstances. So if you're able to have a large house with a big garden, it's much more manageable. But many people do live in large cities, in small flats with 1 or 2 bedrooms with no outside space. Those kind of people who will become from the poorest groups in our society, lockdown is very difficult. You can't really exercise very much. You're going to get very frustrated. You're going to perhaps argue with your household members, and that's something we need to recognise, that people living in those circumstances will suffer mental health problems and probably also increased risk of physical health problems as well.
Certainly, the science of epidemiology has been thrust into the forefront of our daily news bulletins and our understanding of this disease. Today, I've been talking to Professor Azeem Majeed, who's our #1 primary care epidemiologist. Thank you very much, Azeem.
Thank you, Donald. Thank you very much.